Not structures, not slogans, not press releases, medicines. Because when someone is sick, nothing else matters. So I've been really lucky to have joined the Honourable David Seymour over the last few weeks as Pharmac has made a series of announcements about new treatments for New Zealanders. And for those people who need those medicines, it's not about politics, it's about hope. When a cancer drug becomes available that wasn't there before, it's not a policy win, it's actually about a family getting more time together. It's people being able to spend more time with their loved ones. When a chronic condition gets a treatment funded, that's not a line in the budget, that's about someone being able to get out of bed, go to work, be independent and contribute to New Zealand. And when a rare disorder finally has a treatment option, that's not about bureaucracy, it's actually about a parent and a person in our society being able to breathe again, being able to relax and actually enjoy their life. And that's what fixing what matters in health looks like. For too long, our health system's been drifting. It's been focused away from patients. And obviously this week we've been discussing refocusing our health system with the Paiora Act changes. We've become obsessed with structure and ideology, and that's not what we want in health. We want it to actually be about patients. So let me be clear. ACT has been clear that the health system needs to deliver quality, timely care to New Zealanders. And that means actually focusing on outcomes. So we're very proud of the changes we've made with Pharmac and actually changing that organisation to make sure it's delivering for New Zealanders who need important medicines. New Zealanders deserve treatments not based on identity or politics or what box they have to tick. Illnesses don't discriminate. They can hit a family at any time, an individual at any time. And access shouldn't discriminate either. Actually, healthcare is one of the biggest costs to government. There's a lot of pressure, obviously, facing our healthcare system. And when some medicines aren't funded, that means people aren't actually getting the treatment and can contribute to society in the way they want, and also can't spend time with their families and loved ones. That actually affects our whole society. People may not be able to work. They may not be able to earn wages, pay taxes. They may not be able to care for their children, their loved ones. It also often means more interaction with the health care system, going to hospital, visiting GPs, putting more pressure on our system. And so when we fund treatments, we often relieve pressure on other parts of our health system, which is really, really good. Last night I was actually lucky enough, along with my government colleague Nancy Liu from the National Party, to actually join an online meeting which was in relation to World Triple-Negative Breast Cancer. And for those who know a little bit about breast cancer, if you get a diagnosis of triple-negative breast cancer, that is actually very, very serious. There are less treatment options if you have a diagnosis of triple-negative breast cancer. And we were invited to join this meeting by Catherine Cook. And some of you across the Health may have been lobbied by her. And Catherine is a very, very ferocious advocate for trying to get another treatment funded in New Zealand for triple-negative breast cancer. And we were very lucky to actually hear the stories from some amazing women, Dr. Stone, Ali, Jackie, Imogen, Annette, and they were able to talk through about their experience with breast cancer and actually what having treatments means. And so I want to acknowledge Catherine for all her advocacy, and if she does send you an email and does request a meeting, you should take it, learn more about what she's trying to campaign for. But look, I want to say that this government is committed to more treatments for New Zealanders. We are committed to ensuring Pharmac is fit for purpose, and we are committed to ensuring that we actually have a healthcare system where we invest upfront to actually ensure New Zealanders have the health outcomes, are able to contribute to society, and really be able to raise their families and live the lives they want. That's what fixing what matters in healthcare means. Thank you.
So we can't